All right. To everybody who has jumped in, it's really nice to see all of you. Thank you for setting aside 20 minutes to sit down with us. I am stoked to introduce Peter Van Emburgh. He runs global real estate, corporate real estate at CBRE, and is a friend. My name is Andrew Farah. I'm a co-founder and CEO of a company called Density. We do occupancy measurement. But Peter and I have sort of worked on a variety of things together, and we thought it might be good to talk a little bit about bringing employees back to the office safely. And so that's the topic we're going to cover. We've been talking to a bunch of different people, and I thought that Peter's background and experience might be particularly unique. So do you want to say a quick hello, Peter, and maybe your background?
Sure. I don't know if anyone has had any discussions about this topic, Andrew, so it feels kind of new to me still. But no, again, thanks so much for the introduction. Glad to spend some time with you. I'm not hanging out with the redwoods like you are. Instead, hunkered down right outside of Washington, D.C. Probably a 50% chance one of my rambunctious little boys will interrupt me, but that's life right now, right? And like you said, yeah, so I'm head of global real estate for CBRE. I'm a member of one of our task forces, one of many task forces really focused on this topic of returning to work. We have an internal one, of course, because we have our own 530 offices around the world. That's chaired by my boss, who's the global chief operating officer. And we also have a task force that's really focused on the business side and our market leading business experts. And that's chaired by Bill Concannon, who is our founder of our global workplace solutions outsourcing business. But we're talking to a lot of clients, and we're also trying to walk the walk ourselves as we try to figure out how to return to some semblance of normal.
Yeah. So for those who are listening or participating, if you have questions, please just toss them in the chat, and I'll roll through them either asynchronously or as they pop up. We're going to run for about 20 minutes, and then about 10 minutes is set aside for like additional questions or additional back and forth. But I'm actually particularly curious how long it's been since you've had a haircut. Because I mean, obviously we're like all struggling with the same thing. So it's been at least 6 weeks for me.
6 weeks. I think it's about 5 weeks for me. And kind of my routine is to put on a hat every morning, and that kind of helps tamper down the madness so I can look somewhat presentable.
Yeah,
during the workday.
So there are 82 million employees that are going to go back to the office at some point in the U.S. I imagine CBRE, having worked with a huge portion of the Fortune 1000, is talking about how to do so safely. Not just like within its own offices, but also with its clients that it works with. But maybe within your own purview, one, are you having the conversation? And then two, what tend to be the big outstanding questions, the things that you don't know yet?
Kind of a loaded question there, Andrew, but yes, we're definitely thinking about it. From a client standpoint, we've been having discussions with our clients since January. A lot of our clients are multi-region, multinational clients. And so we've been battling on the forefront. We've had techs and building engineers on the front lines of this since, December and January in Pacific. But as far as ourselves, yes, we've been having the conversations around how to return back to work for our own offices. I would say personally, for me, since I've been hunkered down for several weeks with two young boys under the age of 10 and a wife who also works, that I can't wait to return to the office, and it's going to be more of a full sprint than a walk back to work. I'm sure some other people would probably agree. But so and the other aspect is, our workplaces, we design them to be pretty incredible around the built environment to facilitate an employee experience and really, embrace the aspect of collaborating with colleagues. And we talk about, if you're not at work, there's almost a FOMO factor that you're missing out if you're not collaborating with your colleagues in the workplace. Sure. Now, I think it's been interesting since we shut down over 500 offices to force this kind of work from home mandate, in March, that we're absolutely able to work from home. And there will be a lot of employees who are able to continue working from home in the new normal. But we're definitely thinking about, okay, when do we open? How do we open? What are the triggers to activate and say it's all clear for that office to open? And really arming our market leaders, our operations leader with an action-oriented playbook, not a 300-page playbook, but a very clear playbook that can really give them guidance on what does a staggered reentry mean? How do you make sure that the health and the safety and the well-being of our employees is at the forefront? You know, we're kind of employing a beachhead, you know, the first invasion of back to work to try to prepare our offices to work before day one, but then focused on things like building readiness. What are the aspects of the building environment we need to prepare for several weeks before we reoccupy?
Well, so can we actually talk about safety for a second? So like, is safety seems to be a two-sided problem. You have like the actual policies and methods that you implement, you know, cleaning, capacity limits, you know, social distancing inside of a space, you know, PPE of some kind, testing, but then there's the other side of the problem, which is perception of safety, like employee trusting that it's safe when they come back. So is this something that's been brought up, and how are you maybe specifically thinking about both safety policy and safety perception?
So first, on the safety policy, there's also going to be vulnerable employees who we just can't have come back to work.
Mm-hmm.
And so we have to work with our HR and people partners to make sure those people are safe, and it really may not make sense or is safe for them to come back to work, because this is not going to be a mandate for our employees to come back. This is really going to be, okay, it's now clear where you can come back in if you want to and if it's appropriate to do so. Now, to your other point around safety, I mean, you think about there's going to be additional reassurances we'll need to communicate to our employees and our professionals around the steps we're doing to keep them safe. What are we doing to handle the HVAC and just the overall cleaning of the office before we get to work, and the social distancing and some of the reconfiguration? But I think more importantly, Andrew, it's our employees, when they get there and their boots on the ground, they need to have visual cues. They need to smell that the cleaning has taken place. They need to see it in action and see that it's taken place.
Can you give me some practical? Can you give us some practical examples? So, like, what, you know, if CBRE employee comes back to the office, like, what are they going to see? Is it signage? Is it Lysol wipes? Is it a brand new keyboard? You know, we'll get into shared space. I don't want to get into shared space quite yet, because that one's like an interesting one in a few minutes. But like, what am I going to experience if I'm a CBRE employee coming back to the office?
So there's going to be some stuff you just don't see that is being taken care of behind the scenes. We're going to be working with the landlords to make sure that the air ventilation and the HVAC standards have been addressed and taken care of. Our employees won't see that, but we need to communicate and assure them that that has taken place. I mean, you think about today, prior to COVID, our employees didn't even really see or notice that the workspace is being cleaned every night, you know, the silent workforce, the night shift cleaning crews.
Mm-hmm.
And so we need to kind of bring that into the office. Not that we're going to have those cleaning guys with the Ghostbusters backpacks walking around our spaces as we're back at work, but they need to know, with the Lysol wipes that are out and about and the additional day porter presence, you're going to see more of the day porters that are cleaning the common area surfaces, the push-pull handles, all the other common area surfacing cleaning that's going to take place. But then there's also a little bit of a responsibility, and this is my personal belief, a little bit of responsibility that we'll push on the employees where, you know, you're going to have your wipes near your workstation, and there's a little bit of the agency factor to clean down, you know, the desk or the keyboard and the mouse. And we'll get to later, as you said, our feeling about how to still embrace free address or shared workspaces post-COVID.
Sure.
But I think it's a little bit of a balance between things they won't see that we have to assure them are being done behind the scenes, as well as seeing the day porter presence, the additional cleaning steps taking place, touchless sanitizers, all of that will be in their face to just remind them that this is something that's very, very important to us.
Yeah. So there's actually a really good question from Brian. Essentially, like, there's a handful of questions here, but the one maybe we could start with is, like, are you planning for a new way of working for the next 18 to 24 months? Or are you thinking, like, is this a shorter period? Like, how are you thinking about how long-term this may be? Is it 24 months, 12 months?
So
Are you going back
that's a
next
good one.
month?
That's a very active discussion, of course, right now. I think there are immediate capital investments and things that we need to spend money on now before we come back to work. That's what I'm calling the near term, immediate term for investing
Such as
to go
what?
back to work, such as supply chain. We are going to really put a clear focus on making sure our offices are armed with the materials they'll need for day one, additional wipes, sanitizers, all of that. As you can see with our states, it's a really complicated challenge that a lot of our clients and ourselves were dealing with ourselves. And that costs money. And just other additional stepping up of cleaning. We may have to hire some additional day porters and add scope of work for enhanced cleaning for some of our spaces that we are just going to have to budget for. And we're trying to work to capture what those costs will be to bake them into our 2020 budget. But to your other question, Andrew, there are going to be longer term implications. I think the furniture industry, I see some of my friends here online from different furniture providers. There's going to be a lot of discussions around the materiality of the furniture. You know,
all copper.
foam
You're just gonna
pad,
do all copper everywhere, right?
all copper.
Brand
It's
new.
really cheap. Yeah.
That's great.
But there is a lot of discussions around the materiality of furniture, how to make things as contactless as possible. People are just not going to want to really, you know, I think there will be some anxieties around, you know, opening and closing those restroom doors and the other kind of areas and surface areas that have a lot of people's fingerprints on them. And so there's going to be some longer term implications and wholesale shifts in the furniture and workplace industry.
All right. So is like a conference room with 8 people dead? Like our shared spaces, like is it the future where it's easy to clean? You know, shared desks, hoteling, hot desking, shared soft seating, or are you pulling these things out? Like I've heard both sides of the argument, almost even split,
Yeah.
and it's kind of dogmatic. Like we're going to assign seats. It's the only way to keep people safe, and the other direction is, you know, shared is the only way to go. It allows you consistent cleaning and also, you know, some escape. What's your perspective?
So you're touching on a very atomic issue, I think. And yes, there's a lot of discussion, a lot of expert guidance out there I respect tremendously in the design and our occupiers, et cetera, really tackling, you know, free address is over. Shared, give me back my assigned 6x6 cube or 12x12 cube, because that will keep me really safe. Now, my personal view, and I'm not sure if this is one that we're full scale gonna, you know, adopt, but at least my view that is shared with many of my colleagues is that the free address environment is actually really conducive for this. It gives people choice. It removes clutter from the desk and make the desk easier to clean. People can just make decisions on where they do work and what makes sense for them. So for example, in our works, you know, those kind of shared desk workstations and CBRE's Workplace 360 environment, they're free address, meaning they're not assigned. So you can kind of go in, you put your laptop in the docking station, you've got the big widescreen monitor, you've got the keyboard, the mouse. Now we're going to try to encourage people not to really move around between workstations. But again, we don't want to tether the people to them either. And so if you're sitting there or I'm sitting there and colleague is sitting 6 or 8 feet away from me, social distancing, and maybe he's got a little bit of a sniffle. Is that allergies or is that the corona? Maybe I'll just feel better if I just unplug and say, you know what, I'm going to sit over in the cafe area or some other area of the office that's been de-densified to make me feel safe. So again, I believe in choice. Clean desk actually helps with cleaning rather than everyone's tchotchkes and photo frames of their cats. And so I think that you can still create safe distance zones. You can still create social distancing in a free address environment. But
so there's a bunch of really good questions. One that I'm curious about is, will you cap headcount? Are you gonna think
Well, we
about like
cap headcount.
creating limits around just sort of the overall number of humans that can be inside of a floor or a building, or to
So
provide
that
for?
kind of touches on two things. One is the staggered reentry. We want to
Mhm.
be very conscious and not kind of go full throttle back to the workplace. We've learned from a lot of our Asia Pacific occupier clients, as well as our own offices, that the rush to return back to work may not be the best solution, because in examples we saw in Hong Kong and Singapore, they sent everyone back to work and then it was like, oh, case came back, send them back home. We personally want to try to avoid that whiplash factor. So there will be some sort of artificial, gradual, deliberate reentry back to the workforce. And a lot of our occupier clients I know are kind of adopting that similar approach. I think there's differences in how you stagger that entry and where you kind of create that line. But then the second part is the ongoing management of once you return to work.
Yep.
I don't think we'll necessarily have a cap, but we sure as hell are going to monitor it. And I think that's where we want to have utilization software and systems out there and other ways to just monitor who's actually coming back to work. What is our space metrics post-COVID? And I think, you know, at least in the next 6, 8, 12 months, we're probably going to try to limit the idea of jamming people in or having a lot of density in our spaces. So that's something we're really focused on as part of our ongoing management and workplace evolution phase of our playbook.
There are a bunch of really good questions. We're going to do a little bit of rapid fire. Also, I'm going to be asking you stuff. Well, this crew is going to be asking you stuff that you may not know. So I don't know is a completely reasonable answer. If you do know, though, please let us know. Okay, so number one, is there a greater need for private offices? Are you going to see like more people with private offices? I know we covered this a little bit with shared space, but do you think that you'll see an uptick in private offices?
For me, again, this is not the client view. This is for our own CBRE corporate office space. We have a lot of enclosed office spaces. So again, while we're free address and we do have a lot of workstations, we have about 40 to 50% of enclosed spaces inside our environments. They could be private offices, they could be huddle rooms, they can be focus rooms. Where I see the greatest demand is probably our focus rooms. They're not really phone booths, but they're isolated more to one person and you're not taking up an entire office.
How about liability? How scared should people be from a legal perspective?
That's the big issue. I said this to you earlier. I think that's the big issue people are not talking about. That scares me. I think the idea of some of our state governments, and this is not going to be anything political, I promise, but some of our state governments are going to say, look, we're open for business, go back to work. And I think the minute then someone comes down with a sickness in our facilities in a state, maybe that we rush to go back to work, hypothetically, do we open ourselves up to any sort of liability? That's an issue we're also very focused on at the moment.
What about elevators? So you go to New York, right? You go to New York, you got to move thousands of humans to, the 56th floor. In China, there are limits of 2 people per cab. Any thought given to like how you're going to deal with elevators and sort of density inside of elevators?
That's part of our discussion with our landlords. So we have a whole checklist that we've developed prior to reoccupying that is solely focused on our landlord discussions, like the HVAC and ventilation I talked about earlier. Another one is also the building, lobby, and elevator experience. For some of our high rises like San Francisco, New York, it's kind of tall. We occupy some offices in very tall buildings around the world. And that issue kind of terrifies me, because if you are limiting the number of people in these cabs, which I think is the right thing to do, can you just also imagine the backlog in those lobbies, which already seem like a zoo at its best day? And I feel like that's one that we just have to figure out, and we'll be relying on our landlord relationships heavily there.
I mean, Peter, I think it's a wellness program. You just like, look, take the stairs. I know it's 56 flights. This is a part of our new health and wellness holistic approach to coming back.
I like it. I'll let you know how that goes.
Okay, cool. Let's see. These are really good.
There are a lot of good.
Those are good questions.
I do want to touch on, there's a question that Brian mentioned also on sanitation requiring medical and infectious disease expertise. Very good question, because we are not industrial hygienists by trade. I'm certainly not. And so we are certainly looking at different external partnerships who can validate our cleaning standards to make sure that they are third party kind of certified, either from a pandemic expert, like you see some of our academic institutions that are out there as pandemic experts that we're not, but also industrial hygienists, health and safety, environmental experts, which we do have some of those internally. We've had discussion with other outside groups that really try to, focus on the well-being of the built environment, and they have service offerings that can help certify, put a good housekeeping stamp of approval on it, if you say, but that is a really crucial component that you have to rely on the health and safety and environmental and technical expertise to validate that what you're doing is in fact kosher.
So are you going to take temperatures when people show up?
Another big issue. This is a best practice it's kind of socially acceptable in a lot of aspects of Asia Pacific. You just don't really see it in the US, not saying that it can't happen, and it's something we're going to monitor. But there are also a lot of pros and cons, like with anything. Some of the ones that we've seen are reliability of some of the thermal screening, false positives. There's even some articles out there that CDC has talked about lasers in the eyes. We don't want to be burning out the vision of our people, but there's also some really interesting emerging prop tech solutions out there that are kind of focused on the access points that will do thermal imaging as well as building entry and ingress egress. So that is something that I'm certainly interested in, willing to explore and look at, but if we're preparing for the next several weeks, I don't know if that's going to be a immediate near-term solution.
Sure. Are you thinking about also just like we talked to someone who leads a furniture company. He had really interesting insights around like, this is very much a design problem. How do you think about the design of the space? Do you pull seats out of conference rooms? Are you reconfiguring, the distance between desks? Are you thinking about sort of signage? So I guess like, do you have workplace design? Is workplace design sort of thinking about the health, safety, and kind of physical design of the space?
Yeah. So fortunately, we have one of the best workplace strategy teams out there in the business. So CBRE's workplace strategy team and the design studio has been really instrumental and helpful to me. We are marking up floor plans to really show and measure distancing. We are looking at different furniture reconfigurations. I think it's probably an absolute certain that we will pull some chairs out of conference rooms. Mm-hmm. So there will be some sort of furniture reconfiguration and other space planning strategies that we're going to employ day one of our spaces.
So you had a question that you wanted to ask of the crew listening. There's 152 people at the moment. And I think it'd be great if you could maybe we could poll them.
Yes. So my question was, this came out of a very real conversation that we're having, which is, what is the earliest you're hearing occupiers talk about returning to work?
So
we certainly don't want to get ahead. Yeah, sorry.
Oh no, just wanted to say,
there.
If you have an answer, or if you have you've been discussing internally about and I'll have Peter repeat the question, please just post it in the chat, and that way we can kind of log it. So Peter, can you repeat the question again?
Sure. The question was, what is the earliest you're hearing occupiers say that state they'll come back to work? Meaning, our offices will be open no earlier than X.
We've got May 8th.
Wow.
May 1st. June 1st. July 1.
This is something, as the results are piling in, Andrew, this is something we're seeing. Facebook came out with a pronouncement of the earliest they would return to work. Some are saying, we'll follow the state guidance around when, the stay-at-home order has been lifted. but I'm very focused on where companies or occupiers are saying we will return to work no earlier than this.
What do you think the latest is? What's the worst case scenario? And also, this is asymmetric, right? So some regions are going to be able to come back sooner than others. You've already seen this. I mean, you work with, you have offices internationally. So,
Yeah.
you know, I realize there are waves to employees, but I imagine that the dates on when people actually come back will vary by the quality of the governor of their state, you know, sort of the quality of the, you know, local regulations.
Yeah, and I think, again, we're looking at a series of metrics personally. We're actually looking at pulling a state-by-state scorecard, if you will, that it allows us at a leadership level to track when does the stay-at-home work expire? What is the decline in the statistics and positive cases and hospital bed capacity? We're looking at the confirmed cases. We're looking at whether there's a mask requirement. So we're trying to employ a little bit of a data-driven approach based on a publicly available information that's out there, pulling it in through a Tableau interface that allows us to really make smart decisions that's more data-driven rather than politics or state government-driven.
Great. So this is really good, and there's a bunch of questions. If you don't mind, Peter, I'd like to keep rolling for another, call it 5 to 10 minutes, because
Cool.
otherwise we'll stop at about 2. Does that work for you?
Yeah.
All right, cool. One really good question I saw was when, and by the way, if you have an answer to when you think the earliest that an occupier will come back, or what you think the worst case may be, feel free to just toss it in the chat. We're going to keep rolling through some of these other questions. One question was like, when you're walking in an aisle, are you considering setting up one-way sort of routes, you know, so you sort of minimize the likelihood of collision, which, by the way,
I think that
by the way,
saw that out there,
is like the opposite of what an office was designed to do, you know, as
to
of
facilitate collisions, right?
Yeah, exactly.
Yeah. I think that's a very interesting proposition that was put out there. I saw that, bold. I think there's other practical ways that you can limit the social distancing in the common areas. But I mean, we haven't ruled it out, I'll be honest, but I think we're probably looking at more practical rather than incorporating one-way streets.
What about testing? So do you think that I realize that testing is hard to come by. You know, there are different amounts of time it takes to get a test result back. I guess my question is, like, when it is reasonable, is that something that you may provide on site? Are you going to like look to partner with a medical institution of some kind, or bring on an on-site doctor? How are you thinking about sort of being helpful in testing?
Great question. It's one we certainly don't have an answer for yet, and one we're talking about. Maybe it would be a scenario like we had in the, you know, I think it was like the 90s or early 2000s, where companies had those, you know, dock in the boxes or minute clinics on site for some of the buildings. But we don't own, I mean, for CBRE, we don't own any spaces. We don't have any campuses. We're a professional services firm in multi-tenanted office spaces. So the logistics around testing our spaces would be very, very challenging. But it may be a reality that we'll have to live with. But as of right now, we haven't seen a solution or an option that's like, boom, that's how we'll do testing. Because there's just a lot of different scenarios out there where you know, employees that self-report testing, where they're testing locally, and there could be also state and local guidance and restrictions on testing.
Sure. Do you think that we're going to see a reduction in overall real estate or portfolio size? I mean, you know, you could
go either way, because Andrew, there's some companies are saying we need to stop densifying our spaces and we need to open up and get bigger spaces again. So you could have some people that really feel that way, and I'm sure we have clients that feel that way. I personally don't see a scenario where we're going to be harshly pushing increased density, but at the same time, what's going to be the new normal of working from home? And that's another issue that I don't think we're talking about as much. And it's part of really our playbook for the ongoing management is to track. Now people have gotten used to or accustomed to, maybe not loving it, the ability to work from home. And so then it's like, you know what, I could just keep doing my job here. So will that lead to then eventual downsize in the space required by companies? Perhaps. But I think for us, for CBRE and what I have the purview and responsibility for, my job is to make our workplaces friggin' awesome.
Yeah.
And really, I think there are a lot of people out there like me who just can't wait to come back. But I say that jokingly. But you want to create that natural collision point 6 feet away and collaboration with the peers, and that's really instrumental to the culture at CBRE and our workplace program.
What's the benefit of staggering people back into the workplace? I know that you already talked about this for a second, but what is the actual value? Why not bring everybody back? This is a good question. Why not bring everybody back at the same time? Is it just like we're trying to limit our exposure so that there isn't an outbreak, a second sort of resurgence or a local resurgence? What's the real reason?
I mean, I think it goes back to, personally, some lessons learned from Asia Pacific, where we just saw send everyone back in full throttle, and then there was a case, and then you got to all go back home. Where I think having just natural de-densification of the workplace and kind of easing back into it in a deliberate fashion. Some companies kind of go is your last name between A and K or K to Z. I think we're trying to look at a more prescriptive way that really looks at who needs to be in the office, who has critical adjacencies with each other, and working with the workplace strategy team again to help. Maybe it's a local office survey where we can just be really prescriptive on, okay, these people can continue to work from home. We know from HR, these are vulnerable population or other factors that will need to stay at home. But again, for us, we don't want this to be a mandate. That's not our culture to say, you're coming back to work. We do butts and seats, productivity reviews. This is really about, this is unprecedented.
Sure.
No one has the answers, but let's be a little bit more staggered and gradual, I guess, as we try to get to some semblance of business as usual.
So we're going to wrap in just 2 minutes. If you have any additional questions, there's quite a lot of people left. Please post them. I realize that I've sort of selected some. I apologize if I haven't gotten through everybody's questions. I want to make sure that we're sort of covering kind of the gamut of question types. There's a question about filtration. So like HVAC systems. I'm curious if you're going to be making any material investments inside like new HVAC, or if certain buildings are better equipped, with newer systems that can bring in fresh air. Or is that sort of like one of those hand wavy things that's kind of hard to really decide whether or not it's helpful? It's like, it seems like it would be incredibly useful, but like, how do you prove that it is? Just curious if you're thinking about that.
I mean, I think, again, a lot of our clients own spaces. They have different asset types. They have more control over the system, the building systems. For us, again, we are typically in a floor or several floors of a major multi-tenanted high-rise in CBD areas. So frankly, as the end user and corporate real estate executive, I don't really have all that much influence and sway over the building ventilation systems, but we do have good landlord relationships and work with them a lot. So we have, as part of our checklist, to empower our local market leaders, say, look, these are the questions and this is the checklist that you need to make sure the landlord has signed off on around enhanced ventilation standards that we're going to ask that they comply with. So it's less of investments that we'll need to make in our own spaces. Although I know there are some products out there where we could do additional enhancements to the HVAC at our expense. Something we're looking at. Have not made a final decision on that yet either. But I think it's just more about that whole building readiness conversation and how to get the building ready and that partnership with the landlord that we'll do to address the enhanced ventilation.
One of the questions is, are there prop tech solutions, property technologies that you are investing in?
Yeah, I mean, we as a company, yeah, we invest in a lot of different
I
technology
mean,
solutions. But as it relates to prop tech for this,
hmm
one of the things that we've no secret, we have had a relationship with Density, and we did a pilot project to look at your product and
oh,
how we are
thanks for the
evaluating
shout
the
out.
capacity. Little shout out there. And so that is something that we're also evaluating in terms of how do you monitor the post return to work, who's actually returning to work, how are you monitoring those capacities and space metrics so you're not getting too dense. And for someone like me, I have a pretty lean team, but I have a broad portfolio in terms of number of locations. So to be able to have centralized access to data that will show these space metrics at a portfolio-wide level is very important to us. So that's
Yeah.
an example of one prop tech.
If people want to find out more information about CBRE's recommendations, thoughts, perspectives, where is there a good place to go? Is there a post that you can recommend?
Yeah, we have a COVID dedicated website, and I apologize, I don't have it off the top of my head, but I'm
That's
sure
okay.
if you Google CBRE COVID, it has a landing spot. We have released a white paper that reflects the guidance of our task forces that focused on what employers and occupiers should be thinking about. And we have additional details and playbooks and all that is coming to really arm our clients and occupiers, as well as apply to ourselves, because we have to walk the walk and have be in alignment and sync with whatever we're advising our clients to do.
Certainly. Well, to everyone who joined and decided to spend some time with us, and especially to Peter, a big thank you for being here and participating. We will collate some of these answers and try to share them with everybody who attended. And we're going to try to be doing this a bit more often. So, Peter, any last messages for the crew?
No, this is fun. And I think, again, this is truly unprecedented. I think we're going to see a lot of changes happen to this industry and kind of an evolution of the workplace. I think as you know, I grew up outside of New York City, and so post 9/11, there were just a lot of really wholesale change in behaviors that we saw as people returned back to work in downtown New York. And certainly not trying to compare it to that situation, but I think you'll just see a kind of really wholesale coordinated effort to really think strategically about how does this industry evolve and adapt and change to put the health and safety and well-being of our employees at the forefront.
Yeah, certainly. Your questions, everyone who participated, your questions were excellent. Thank you so much for adding. Thank
Yeah.
you so much for participating, and we will see you next time. Thanks very much. Bye.